So we'll be taking you through a journey of SHA in 2 years. And Your Excellency, we are calling it reform measured in lives. Your Excellency, to begin with, we have 32.3 million Kenyans registered. And if we compare with where NHIF was at its best, we had 16.9 million Kenyans at that time, and now we are 32.3 million Kenyans registered. In terms of access, Your Excellency, we have an increase in the number of facilities from 8,667 to 10,713. And then some key impacts that is measured in lives. 2 years of NHIF, we had 227,741 surgeries. And in just 2 years for SHA, Your Excellency, we have been able to facilitate 501,839 surgeries. When you come to renal care, we have 8,831 patients during NHIF time for 2 years. During SHA, we've nearly tripled that to 20,952 beneficiaries. Your Excellency will take you through then what the impact has looked like. In terms of numbers, that's how our registration has changed. 15.5 more million Kenyans are now covered under the Social Health Authority. Your Excellency, the next slide. We have care closer to Kenyans. If you look at our facility density, moving from 8,000 to 10,713 means more Kenyans are accessing more facilities. And if we look at the breakdown, Your Excellency, government facilities are more at 5,959, 4,534 private, and FBOs at 541. The next slide, Your Excellency, tells us about the resources. 178.5 billion paid out in all the funds. You can see the Social Health Insurance Fund has catered for 134 billion, PHC at 23 billion, public officers at 16.9 billion, and ECCIF at 3.5 billion. Your Excellency, when we look at PHC, what does it look like in terms of Kenyans' lives? 9.3 million Kenyans have benefited from primary health care services. That's an increment of close to 27% from NHIF time. When we look at, Your Excellency, deliveries, our mothers, at NHIF at its best, we had 985 million mothers. For SHA, we've paid 1.3 million mothers who've been able to deliver through SHA and paid out 17 billion to those mothers. In the next slide, Your Excellency, cancer patients. During NHIF took care of 29,473 cancer patients. SHA has taken care of 50,000 cancer patients. Next slide. In terms of renal care, again, Your Excellency, we started at 8,831 for NHIF. 20,952 Kenyans have benefited from SHA. Your Excellency, when it comes to surgeries, 501,839 surgeries have taken place paid for by SHA, and Kenyans have benefited from that. Your Excellency, in terms of critical care, NHIF did not cover for ICU. We used to pay zero in NHIF days. Now SHA is paying 28,000, and 31,975 Kenyans have benefited from ICU services. And Your Excellency, the newly launched Ambulance Dispatch Center, Your Excellency, from the time you launched this Ambulance Dispatch Center, we've had 506 incidences that we've been able to dispatch and reach Kenyans. And we've had 18,534 calls come in the last 2 weeks.